Professor Omolola, Orenuga, Department of Child Dental Health, College of Medicine, University of Lagos, and Lagos University Teaching Hospital, Honorary Consultant, Paediatric Dentistry, and Professor of Paediatric Dentistry. In celebrating the World Toothache Day, we'll be talking about toothache today. A number of people in the population, especially children, young adults, have experienced some form of toothache at some point in their time. And to be very interesting to learn about toothache. So what is toothache? Just to put it very simple, is a pain or swelling around the tooth, and it's usually caused by tooth decay. Well, in local parlance, you will hear it, people call it akukuru, jane in our local Nigerian language, and it could be as a result of an infection in your gums. That's the soft tissue around the tooth. So what causes this type of thing? It could be because there is a hole in the tooth, or there is a problem with the gum. Sometimes it could be as a result of infection around the neck of the tooth. And this infection around the neck of the tooth could be because the person is using bad toothbrushing habits. Because we usually advise our patients on the way to brush their teeth so that it doesn't damage the soft tissues around the gums. So when you have toothache, you wonder what we need to do. There are a number of remedies, local remedies that people have carried out at home. You visit, these local remedies don't often work, they're temporary. I will tell you that the best thing to do is to visit your dentist when you experience a toothache. The local remedies are usually very temporary. Maybe you put, they use very local items. I would not recommend those things, touch and go, battery water. They're funny things you hear about. Those things are not encouraged because they further damage your tooth. And not only damaging your tooth, it could be detrimental to your health. So you need to visit your dentist to find out what exactly is wrong. And our doors are always open. So the dentist will have a look at your tooth and advise you on the best way to go. But you can always prevent your coming down with the toothache by doing the right things. Basically, we have known that what are the causes? How do you get this toothache? So how do you get the toothache? Maybe you're eating the wrong foods, sugary foods that when left in the mouth, bacteria in the mouth, which are normal, inhabitants of our mouths, they work on the food remnants that is left. They break down those food remnants and invariably produce acid. And it's this acid that is produced as a result of the bacteria acting on the food remnants. The bacteria acts on the food remnants, and this acid produced will now cause degradation, breaking down of the tooth surfaces, and then the tooth continues to break down. That's one way in which you can have a tooth problem. The other way I talked about our way of brushing. The way we teach patients to brush, people to brush, not necessarily. We should brush when you use, whether you're using a toothbrush, which is highly recommended, or chewing stick, as much rural people want to use chewing sticks because they're used to it. You are supposed to brush away from the soft tissues of your tooth. That is, away from your gums. Because if you brush towards your gum, you're damaging your gum. You're removing that gum tissue away from the tooth and further exposing the root of the tooth. If the root of the tooth is exposed, there can be sensitivity, and when there is sensitivity, there will be pain. Another way in which toothache occurs is we have people that open their mouth when they're sleeping, there's drying of the teeth, and there could be the enamel, that's the outer surface covering of the tooth, which protects the inner one that has the nerve endings. Once that is taken off, the dentin gets exposed and there could be sensitivity. The other way in which toothache can also arise is there's some people that when they're sleeping at night or even unconsciously during the day, you find out that they're clenching, it's as if they're chewing something in their sleep. They make some funny noises, clenching their teeth. We call it bruxism. And this habit can lead into grinding of the tooth surfaces, and as the tooth surfaces are being ground down, the tooth surface is being ground down, the dentine is exposed because the enamel is chipped off. So what do? People have asked a number of times whether brushing your teeth properly will take away the toothache. But I tell you, brushing alone will not take away the. So a number of people have asked, oh, will brushing my teeth stop my toothache? If you have a toothache, brushing your teeth will only make your teeth cleaner, your mouth cleaner. It's not going to stop the toothache. The best thing is to visit your dentist so that they can find out the cause of the toothache. Because removing the debris on the surfaces of the tooth does not mean that the toothache is going to go. You're going to just have temporary relief, and you also have temporary relief by taking medications until the cause of the toothache, whether it is a bad tooth that needs to be filled. We have fillings that we place on the teeth. When you come, we assess it. Does it need a filling? We put a filling. Does it need to be removed? That is extraction. We remove the tooth and place another one in there. We place a false tooth, and there are different types of false tooth that one can get. At the same time, number of people wonder that, oh, when I'm sleeping at night and I have a toothache, I don't feel anything during the day. The pain is not as much, but at night when I'm sleeping, I find out that just lying down increases the pain of the toothache. What happens at night is that there's increased blood flow. The blood flow to your brain, to the one's brain, is increased. Not that there's more blood flow, and so that's saying that there's more amount of circulation of blood around the tooth, because your tooth is in your head anyway. Is in the jaws, which are in your head. So of course, because the increased blood flow exerts pressure on the tooth that has the pain. So lastly, what are the different types of toothache? If you have experienced toothache before, you will know that for women, they tell you, oh, or our mothers, they tell you, oh, it is worse than having a baby. It can be worse than that. And this is because you just feel that, oh, you need to get this thing out. There can be some that will be just sharp and you just want to get it out of the way. There are other types of pains that will be dull and you just linger there. And there's some that is just when you drink water, whether hot or cold, that you have a reaction. Whatever type of toothache you have, whether it is dull, whether it is lingering, whether it is persistent, sensitive, whether it is sharp, whether it is severe and troubling, the onus is on you to seek medical attention. When I say medical attention, see your dentist so that you are in the best position, because your dentist is in the best position to give you the best treatment for the toothache. The dentist will assess what is wrong and then advise you on the options for treatment and give you the best treatment. In addition, finally, what can you do to prevent your having toothache? We talk about prevention. Prevention, we know, is better than cure. How can we prevent our getting the toothache? First and foremost, before coming to your dentist, what you can do at home to help yourself: oral hygiene practices. What do I mean by oral hygiene practices? Brushing your teeth with a toothbrush and using a fluoride toothpaste, because the fluoride in the toothpaste helps to prevent tooth decay, because it adds to it fortifies the teeth against tooth decay. So you use a toothbrush, preferably medium toothbrush, and you have to brush at least twice a day, morning and night last thing at night before going to bed. Because when you're sleeping at night, imagine you have eaten so much during the day and you have all this sticky dodo in your mouth and you just go to bed with it. And like I said before, there's bacteria that are normally in the mouth. These bacteria in the mouth, when you are asleep in the night, they are not sleeping. So all those rubbish, remnants of dodo, jollof rice, all those sweet things that you have taken during the day, they will now go to work and start working on those things. They are very busy. So when they are working on it, they start releasing that acid I spoke about initially, and it's the acid that now goes to work and destroys the tooth structure, and then we have tooth decay. So it's important that you brush last thing at night before going to bed, in the morning, preferably after breakfast. But a lot of people, when they wake up, they feel, oh, my mouth is not feeling that, I like to brush. You can rinse out, but once you add your breakfast or anytime you eat during the day, it is good that you try and rinse off, especially when you have taken anything that is sticking. And we do take a lot of things that are sticking and retain on our teeth, and this includes chocolates, dodo, bread. Those are the stable things in our diet. So, and a lot of us are in the habit of giving our children foods that we call that are not tooth friendly, like the chocolates, the cake, the ice cream, the Fanta and everything. So instead of giving them all these things as snacks for school, what do we need to give them? We give them apple. An apple a day keeps the doctor, the dentist away. So give them apple, give them carrots, give them all the fruits that are available, and they're more healthy because they're a good source of vitamin C as opposed to the ones that have sugar. Then if it's a child or persons that have some illnesses that they've been battling with and they have to be on, especially for young children who take syrups, when they take these sweetened syrups, ensure that they clean their mouth very well. At the same time, you need to know that your brushing technique also is very important. I said brush away from your gums, away from the soft tissue around the teeth, so that you don't damage your gums and expose the roots of the teeth. If you have any other conditions, such as where an individual clenches or bites, it means that you need to find out, why are we clenching? Is it because of a stress condition that has to be attended to? And most importantly, it's good that you see your dentist before things get out of place. Most people in Nigeria and even internationally only come to see the doctor when they're in pain. They don't think that it's necessary to see a doctor. But we all buy clothes. We do a lot of things that we're not supposed to be doing. We buy clothes even when you don't need them. So why don't you see your doctor and save yourself the pain? So prevention is better than cure. See your dentist at least twice a year, once in 6 months, so as to make sure that you're in good health, in good shape, and you avoid the pains that come with toothache and its antecedents. Thank you.